Hi, I'm Dr. Sindhura B. I'm a fertility consultant at Cloudnine, Banjara Hills. We don't really do surgery for every couple who walks in. We categorize whether they have uterine pathologies or ovarian pathologies or cervical pathologies. That is how we divide. Now, when I say uterine pathology, what are the pathologies which we operate so that the fertility increases? One such thing is a fibroid. Now, not every fibroid has to be tackled. You tackle the fibroids, only the ones which are bothering you, only the ones which are very big in size, say more than 7 centimeters, and the ones which are protruding into the cavity. Again, the location of the fibroid matters. Only those kind of fibroids are to be taken out. Then probably it will again reorganize the blood supply to the uterus, and again there is more chances of falling pregnant. Same thing goes with adenomyosis. When it is a very bad adenomyosis. When I say adenomyosis, it is the endometrial tissue, whatever cushion that forms inside the uterus to hold the baby. If that is formed anywhere outside, it's called endometriosis. This, when it is stuck into the uterine muscles, it's called adenomyosis. When that happens, adenomyosis again alters the blood supply to the uterus. These are all not done for everybody. You have to fit into the criteria, and we as fertility specialists, we assess whether you fall into the criteria or no. If that's so, then we do a laparoscopic surgery and remove the endometriosis or remove the adenomatic component, remove the myomas. Now, this is the utrine. Inside the cavity, when there is any kind of growth inside the cavity, it doesn't allow the baby to grow again. That can be fibroid and that can be polyps. Now, these polyps are non-dangerous ones. They don't really cause any trouble. There are again different kinds of polyps. There's something called endometrial polyps, which again, every month it changes. This month if it is seen, then next month it's not seen again. But there's something called persistent polyps that can be fibroid polyps as well. These have to be removed. Again, this is done by a hysteroscopy and we remove the cavity. Before any IVF, we always assess the cavities. Make sure that, any procedure when we want to do, we always make sure that, it's 100% okay to go ahead with these procedures. The next question what you would have is, how soon can I plan pregnancy? Will I naturally conceive after a laparoscopy procedures or after any kind of fertility enhancing procedures? Well, for that question, I would say yes, natural pregnancies are very well capable and, possible. But again, you give a gap of 3 months with major laparoscopic surgeries before you plan your pregnancy. If it's a minor ones, you can discuss with your fertility expert and you both can decide how fast, how soon you can start your fertility treatments.